My name is Dr. Naomi Esther Blemire, Chairwoman for the North Miami Commission for Women. I now call this meeting to order. Good evening, everyone. It's a pleasure to have you all here in the chambers for our, not last meeting, but we have one more meeting to go. The last meeting will be Tuesday, December 16th. And at this time, I will do the roll call.
Okay.
Dr. Marie Etienne,
Present.
Dr. Narissa Glickman,
Present.
Commissioner Pazmino,
Present.
Naomi Blemire, present. Emanuela Fleurimont, at this time, we will do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Are there any amendments to the agenda? At this time, we're going to move with old business. Last meeting for the month of October, we were able to present the annual Miami-Dade County Women's Leadership Summit. This initiative was presented by myself. The North Miami Commission for Women proposed hosting an annual Miami-Dade Commission for Women Summit, uniting women leaders across the county to 1, strengthen partnerships and sharing best practices, 2, highlight innovative community initiatives, 3, identify shared challenges and collaborative solutions, last but not least, empower women to lead and serve more effectively. The purpose of this summit was to create a unified space where city, county, and community leaders collaborate on advancing equity, leadership, and opportunity for women and girls across Miami-Dade County. The time that was proposed for this countywide summit would be the spring of 2026, the month of March, which is Women's History Month. The proposed partners at this time, we are proposing that we establish a 12-member committee that consists of Commission for Women, leaders, organizations, and small businesses led by women in Miami-Dade County, the Miami-Dade Commission for Women, municipal commissions throughout the county, Chamber of Commerce, educational institutions, nonprofit organization, and community advocacy groups. At this time, we would like to open for discussion, as we know that the last meeting, we did not have time to go in depth on what this summit would look like, and at this time, we would like to do so. Commissioner Pazmino?
No. No.
And no, this was proposed by myself at the
I
last
seconded.
meeting. She seconded, we voted, and it was passed.
For this March.
It is proposed for this March, correct?
I mean, I like the idea. And like you said, the last meeting was very productive, very informative. I'm just hoping that that leaves us with 3 months, well, 2 months actually, to try to put it together.
So the idea is that we are not the ones to quote unquote put it together. We will bring together resources and leadership from the City of North Miami, Miami-Dade County Commission for Women, and all of the other Commission for Women that were present at the last meeting, as well as the community-led organizations that believed in this project. So the idea is not that we look at it as we are putting it together, but it is a
Partnership.
it is a partnership that we are all putting our resources, time, and effort to bring this to fruition. Now, are you stating that that is not enough time? What are your
My
What are your
concern
thoughts?
is, yes, to get in touch with all the other organizations and try to get all of us have a date available. Because I'm thinking they might already have March full, but we can intent and see. We can try and see. And is it going to be hosted here at the chambers, or is it something that we have to have a venue for?
No, Ms. Pesmino. Commissioner Pesmino, this is a county-wide summit. So we're talking about from Homestead. I need you to zero in on 30 plus cities in Miami-Dade County that women would come from near and far to be a part of the summit. There is no way that it would be able to be held here. We would have to identify a venue. I think a venue that could hold at least 1,000 plus women. I think it would be great for us to partner with universities, because that actually gives us access to space, right? And of course, students. And so that would be the first level of partnership. Second level of partnership would be the commissions themselves, because they are already leading within their respective cities. And then we can look at community-led organizations led by females within Miami-Dade County that would want to take part in this.
Okay.
So the idea is to work with organizations that already have a community-based foundation. So they would just be essentially reaching out to those that they're servicing to invite them.
I understand now. Again, I'm just concerned about the time, but if I have no problem with it, hopefully it can happen in March. I'm just concerned about time-wise.
Well, this is why we are proposing putting a 12-member committee together to ensure that, one, there's an entire agenda set. Number two, there are deadlines to meet, and that those who are part of the committee would actually begin the work. Now, we have spoken to two of the state commissioners who were here, and both are interested in being part of the committee. So it's not necessarily about resources per se. It's really bringing the leaders together to put it together.
All right.
Any other questions?
No.
Excellent. Commissioner Glitman?
I would like to suggest to have leader like Balance of Life to come and join us, because they are great leadership. They've been 10 years in this area in North Miami. So I would love to invite them. This is one of the organization, and so many other great organizations. So we can easily have enough nonprofit and community to do it together. Thank you.
Thank you so very much. Balance in Life, it would be an honor for us to actually take part in this summit, especially with the fact that as of December 31st, I will no longer be on the board. And so it would be an honor to work in that capacity.
You're not going to live so easy.
If I may.
Thank you, Narissa. Thank you. Dr. Etienne.
Yes, I second the recommendation. Well, actually, I agree with Commissioner Pazmizo's concern, but as you stated, Madam Chair, there will be a committee put together. So usually when you have committees put together, we come up with the timeline, and the fact that they were in agreement to having it, I think we should be okay. Since the Madam Chairwoman is no longer going to be a commissioner with the City of North Miami, and she is the founder for Balance of Life. Balance of Life. I propose that because you initiated this, perhaps you can consider chairing the committee, and that way we can have a plan, make in motion, so we can start rolling it out. But me personally, I want to let you know that I already have Humanitarian Medical Mission, March 13th through the 17th.
Hold on, let's pull
Let
that
me
up.
give you some
Okay.
dates.
March 13th through the
17th,
17th. okay?
Humanitarian Medical Mission, and I also have the Power and Influence for lunch, Power and Influence luncheon with the Global Innovative Foundation at the Biltmore on March 27. So,
Okay.
and the weekend of the 20th, 21st to the 22nd is my mother's birthday. I'm going to be out of town in Orlando. So I just want you to be aware that the only date that's open for me, if it's done during the weekday, I'm okay. If it's done on a Saturday, the only Saturday I have open is the 7th.
The only Saturday you have open is the 7th.
Correct.
Thank you. Now, so
It's not about me. Be clear.
right. Let's take it one step. And so, yes, I would be honored to chair the inaugural Miami-Dade Women's Summit. I truly believe in this effort, and I think that it would truly bring resources and an abundance of assistance and light to the woman in Miami-Dade County. Now, as it relates to the month of March, because we would want to continue this annually, I think that it makes sense to do it on a Saturday because we want to allow women who are 9-to-5 workers.
Oh, I'm open on the 28th,
Okay.
but I know Pearls Women Foundation does their thing on the 28th for lunch.
So we would want to ensure that this event is on a Saturday because we know that during the week women are working, and one of the reasons why we brought this to the forefront is because we wanted to engage women who may not necessarily have time to come to commission meetings and who may not necessarily have time to be engaged civically. And we wanted to create a space for them, if not just once a year, for them to take part in this. So I would like to propose, although we have not put our 12 members together, I would like to propose that it is on a weekend and that it is on a Saturday so that we can engage mothers and workers who work Monday through Friday, and the weekend may just be that opportune time for them to attend such an event. Are there any concerns with doing it on a Saturday?
Dr. Etienne, you say that you cannot do it on the 27th. Is it the whole weekend or just that day? The weekend 28, you're available?
I'm available on
7th and
Saturday the
28th?
7th, but you know, we try not to conflict with other people's
Okay.
activity. I know Pearls Women Foundation, they usually do their luncheon that Saturday the 28th, but I'm just saying that my
About
priority
21st.
would be here, of course,
And
for the commission. So if the only two dates that I have open on my calendar right now is Saturday,
and the
March
28th.
7th, or the 28th, which is a little bit tough.
Okay,
That's
so
me
we-
only 28 because on the 7th, I have a Rotary leadership. I will be in Orlando for the whole weekend.
For March 7th?
7, yeah.
Okay. So
Claudia.
so 28,
How's your schedule?
Commissioner Pessamino?
Right now it's open, but
Okay.
stuff might come up.
Okay, great. So I will, so within the next 7 days,
Mm-hmm.
I will I will reach out to the other commissioners as well as the State Commission for Women, and we will put together a 12-member committee and to move this forward. And so I would envision by the end of by December 31st, we would have a confirmed date, confirmed location.
Yeah, and in terms of location, I would like to recommend an academic institution, Miami-Dade College North Campus, because it's in North Miami. It's centrally located for anybody who's coming from north, south. It would be the Social Justice Building, because that's
Is
the
that the new
biggest.
building?
Yeah, that's the biggest building that can take up to 600 folks.
600?
I think so, more than
Didn't you guys have another location that can take up for like 1,000?
the. There are many. I mean, all the campuses are great, but I know the Social Justice Building is huge.
But it can
and
only sit 600?
I don't have the exact
Okay.
information. I can look it up.
Okay,
But
great.
the Chapman Center is downtown Miami.
Mm-hmm.
That's another location. Again, you would have to talk with Provost.
No, that's perfectly fine. Thank you so very much. I think partnering with
Barry University is another because it's right. I'm looking at in our city.
yes.
And so Barry University, Miami-Dade College, those are the two academic institutions that's located in North Miami
That I'm
aware of.
Right. No. So we want to make sure that if we have to go outside of North Miami, we go. We want to make sure that FIU, we would just want to make sure that we have a location that can hold a minimum of 1,000 women. I think that makes sense so that we can actually market to women who are in Miami-Dade County and know that, a 600-seater, is that great? Yes. But that does that really put a dent in Miami-Dade women? No. I think if we can find a place that holds at minimum 1,000 ladies, I think that would be best. The time is 7:20. The chair recognizes Dr. Florimont. So I think that it would be best if we seek a location that seats at least 1,000. What I can do is, Dr. Etienne, if you don't mind, I can pull on you in the next couple of days just to look at the different facilities at Miami-Dade. I agree with you. It is centrally located. It is a place that people know.
Oh, it's a 120,000 square foot multi-purpose building.
Facility. Okay.
Yes.
And how many people does it send?
Let me see.
I think that probably would be the best.
Hold on.
Okay, as she looks at that, does anyone have any other add-ons?
Well, as you mentioned, FIU, the Coven Center, which is their conference center, I don't know how many people they hold.
Coven,
Small.
it's too small. We need 1,000. Minimum 1,000.
I think it's more than. I'll call.
Excellent.
I'll call and
So if
find
you
out.
can please help us put that together, that would be great. As I stated, I believe that at minimum before December 31st, we need to have put the 12 member of 12 together, identify the location, confirm the date, and move forward with promotion. As I shared with you guys, I believe that we should definitely look at putting together a list of a minimum 100 organizations, leaders, commissions, as well as advocacy groups that would immediately receive the first invitation. And I think that would put us in a very good position to really engage 1,000 women in Miami-Dade County. Any thoughts? So what we can do is, as of tonight, we know for a fact that during our meeting, we had so many different leaders here who were already engaged. We have a list of all of the ones that we invited. We're going to start off with the list of the first 100, which would include organizations like HANA, Haitian Lawyers Association, the Miami Women's Club, the North Miami Beach Commission for Women, Doral Commission for Women, the City of Miami Beach Commission for Women. We know that the City of Hialeah Commission for Women, the Rotary. I know within the next 72 hours, we can come up a list with 100, and then from there we'll go for it. Any concerns, questions?
Yeah, one of the suggestions that I would make is not only to put out a press release as a recommendation to the committee, but also do a press conference to publicize the actual event so that if it's a free event, you are going to get people to come. So your committee need to decide, is it going to be a free event? If so, who are the targeted audience? And if you say it's to support women who cannot come to meetings on the city or any other cities, do they have transportation to go? So those are some food for thoughts for the committee to think about.
Thank you. I think that that's really great. That could probably lead us to doing some kind of partnership, reaching out to maybe a company like Uber. To see what we can put together. I love that idea. Thank you, Dr. Etienne. I think that reaches home. It meets people where they are. I do also believe that in order for us to have a buy-in, I mean, I've been doing events and conferences since 2018, I would say. And so, even if it's just a minimal cost, you want people to invest, so when they say they're coming, that they actually come. So we can definitely look at what is a minimal cost that does not break the bank and that gives the average woman the opportunity to attend. And of course, we can find ways where we can possibly give out free tickets to different organizations that are leading women's issues within the community, and they can share those free tickets with their members. We can definitely do that, but I do think we should definitely put a minimal cost on it.
I got your response.
Excellent. Thank you, Dr.
Theater style, it's 1,000.
Excellent.
Theater style.
Theater style is
But if you're
1,000.
doing, it'll be a little bit.
Excellent. And I'm sure that they have breakout rooms and things like that, right? Of
It's a
course.
multi-purpose room.
Excellent. If you can.
Banquet is 600.
Excellent.
Banquet style.
Banquet style. Okay, excellent. Thank you so very much. If you can please share, I know you said it on the record, but if you can please share the full name of the facility, the address, and we will move forward to reaching out and beginning those conversations. Thank you so very much for your assistance. Okay, do we have any other questions? So right now, we have 2 dates, either March 7th or March 28th on the calendar. Understanding that as a city, we are the facilitators, and so it would be extremely important for us to have all members of the North Miami Commission present, and so we will work diligently to ensure that happens, right? To the extent that we can. And I think that as we move forward, once we put the 12-member committee together, the next step would be to present them to the North Miami Commission, so you know exactly who is leading. Now that I have accepted the responsibility as the chair, I will ensure that I am giving a report to the North Miami Commission for Women on everything that is taking place. I can do so several different ways. I can email the reports. I can come to your meetings and actually say, okay, this is where we're at. So we make sure that there's an open line of communication and that you all are in the know of what's going on, what's the budget, speakers, and what have you. I will definitely do that. Do we have any other questions concerning the summit?
Like Dr. Tien say, we should have some press release. Perhaps we can find out soon. By next month, we can have a Save the Day flyer to send around the community.
Excellent. Thank you so very much. Again, within the next 7 days, my commitment to the North Miami Commission for Women is to put a 12-member committee together for the annual Miami-Dade County Women's Leadership Summit. And as the chair of the Leadership Summit, I will ensure that monthly, or let's say twice a month, I will bring a report, one which would be emailed and the other one in person, to give the North Miami Commission for Women a detailed breakdown of the decisions that are being made concerning the summit, specifically before December 31st, date, time, and location. Any
Okay,
questions?
What is the selection process for the 12-member committee?
So, as I stated to Commissioner Pazmino, we want the Commission for Women who are already established to be a part of it, because a lot of the women may not have time to come to their meetings. So this might be a way for them to engage that city. And so obviously they have to agree to have a member of their commission take the lead and be the liaison, if you will, for them. So we have City of Doral that we will reach out to, City of Miami Beach, City of North Miami Beach, City of Miami Gardens, and the City of Hialeah. We know that those 5 cities have an active commission for women that meets and that are working diligently towards the betterment of the women in their city. Now, we also have the City of Miami with the Women's Club, and whose president is Metris. Now, why that is important is because that women's club is not just one club. Our vice chair is actually part of the Cocoa Plum Women's Club. Can you tell us in Miami-Dade how many clubs are there?
We have at least 10 clubs. We have around 10 clubs in Miami area.
Excellent. So, and this is why it's so important to discuss this, because Commissioner Pazmino stated something that was, obviously really important. How do we reach out to, 10,000 women in this period of time to convene 10%, about 1,000? And it is doing it specifically through women groups that are already organized. Okay, we're not reinventing the wheel. We're not going to look for them. We have entire cities that have Commission for Women that are already established, and these cities have, residents of minimum of 50,000. Even if half of them are female, you're talking about 25,000, right? So it's a matter of them, the Commission for Women, being activated. And I think this is what this is actually going to do. It's going to give the Commission for Women, especially in these 4 different cities, an opportunity to activate the women in their city, get them to come together and convene together so that we can better serve them. Commissioner Pazmino?
I understand. I know my concern was getting the speakers, because I'm all to agree on a certain date from each commission. That was my main issue.
So I think that, where we as a commission have some leverage,
Yes.
because we are the facilitators, and obviously a large percentage of the work is going to be backed by us, meaning physical work, writing the letters, sending the letters out, emailing, making sure that the city of North Miami puts someone on staff to actually help us with the process. I think that we should go forward or lean in with the dates that we are able to serve and then present it to the
Other commissions and see
other
if they're
commissions
available.
and see out of the 12 that we pick, let's see if it's, we have 2 days, the 7th or the 28th. And then whichever one works, then we're giving that to them. Because at the end of the day, if we're going to carry the brunt of the work, you know, at least, you know, 5 of us have to be present at minimum.
Right.
Are we in agreement?
Yes.
Yeah.
Okay.
Commissioner Emanuela, so I don't know if we were discussing about a date in March. Do you have any commitments in March? Right now, we're looking at the date March 7 and 28.
I don't know,
Oh, no, until
because
May.
I don't have nothing regarding.
It's a little it's
Yeah.
close.
No, I said the same thing. That
So,
right now I
don't-
cannot.
I cannot say yes or no because I don't really know. But if you already have that day reserved, so I will make sure that I
Okay.
reserve it. If it's not already have something on it, I will maybe reserve it. So I have to get back to you on that.
No, I
Commissioner-
said the same thing. I said as of
We're saying, I know you usually collaborate with the humanitarian mission for Immokalee. The date, we already have the date is March 13th
To 17.
through the 17th.
Oh, okay,
So that you're not available.
okay. So I'm not
Exactly.
available.
You're not.
Okay, so we have the 7th and the 28th that we'll move forward with. Do we have any other questions, concerns?
I thought we say that 7 we cannot, and then the
Because she's not going to be here.
Okay,
Yeah,
I'm sorry. Yes, Vice Chair, you did say the 7th you're not available, so we're looking at the 28th.
Mm-hmm.
Okay? That, well,
If,
yeah.
March 20th is the last Saturday of the month. We have something at job that's already planned.
You might please.
Thank you so much. Yeah, on the 28th, MJD, every last Saturday of the month, they have an event. So they may have an event that day. So I have to confirm, but it's depending on where the event is. If it's something that local, I don't have to be part of it. But if it's something that with another entity is not local, like North Miami Beach, I have to be there. So I have to coordinate with my event coordinator to find out if the date it's a local event date or not.
okay. So please, if you can, within 24
No, I
hours-
can give the answer by tomorrow.
Okay, perfect.
May I ask, narrow the picture? Will that be an evening event or daytime event?
So it is a daytime. Again, we're shooting for Saturday, you know, 4 hours.
Lunch?
Yeah, 4 to 5 hours, giving the women time for general sessions and breakout sessions that have to do with, you know,
10 to 3.
health, parenting,
like 10 to 4, 10
10
to 3.
to 3, 10 to 4.
10 to 3.
Yeah, to give them an opportunity to get connected to resources. Okay, at this time we can move forward with. As the chair, I would like to present to the 11 members what we envision. So let's discuss 5 topics that.
Oh, I do have a recommendation.
Yes,
on the
please.
committee selection. Since you mentioned that we have the city of Doral,
Yes.
city of Miami Beach,
Yes.
city of North Miami Beach, city of Miami Gardens, and the city of Hialeah. So that is 1, 2, 3, 4, 5.
Yes.
Plus
those
us
are.
makes 6.
Yes. Those are active commission for women.
Correct. So my recommendation is that you ask for 1 member. It could be the chair or vice chair or any board member they want to designate
Correct.
for each of those. So that gives you 5.
Correct.
You make 6.
Correct.
And then the other 6, I'm recommending that you get somebody from a chamber of commerce from the city. Okay. the city,
Maybe the Miami-Dade Chamber of Commerce.
the Miami-Dade, yeah, one, each of the commerce. So you get one, so that gives you two, right? So that gives you 2 plus 6 makes you 8. And then.
And remember, we already have two state commission.
Right.
That
so
has already.
we adding them up. So that way we make sure. So you have 8 total, right? And then I'm looking at, let me finish my thoughts and
Yeah,
then you
go
can take
ahead.
over. Yeah.
Good.
So we have, you mentioned that we want this to be inclusive of a nonprofit leader. So we definitely want to have a health person, somebody from the Haitian American nurses or the Miami chapter Black nurses or the Hispanic nurses, at least somebody from the health arena,
Okay.
from a nonprofit sector, from these organizations, and definitely a mental health component organization. It could be former Commissioner Magda. Okay, from her, it could be, she could make a recommendation as well, or she could be part of, because you need to address the mental health piece, or you can get somebody from Webati Santé Mentale. That would give you a total of 10.
Okay.
Okay, so we cover business, mental, we cover health, and someone definitely from an academic institution.
So the academic institution, I think, is major. Depending on where we work, obviously the reports are coming from UM. That would be ideal. I will
You can
make the
have- yeah.
connection within the next 7 days to see who from their institution would be the best person. And of course, we have to think about budgeting. So we want to make sure that the academic institution has the funds in order to help sponsor such an event. So of course, we can look at FIU, we can look at Barry.
And I'm also wondering for the,
Now, just
shouldn't it be 13?
No, what I was going to say now, just so we know, remember, the 12 are the doers. They're going to actually do. But we're putting a list of 500.
It should be 13. You should always have a even number
Odd number.
or a committee.
So what we're looking at is, or it could be 11, but what
or
we're
11,
looking at is to ensure that we have a list of 500 community-led organizations, individuals, businesses, women in leadership that is going to back this day. Okay? And so let's say, for instance, if FIU is part of the 12, UM and Barry can be part of the 500 or part of the first 100, which is what we're going to work with. And then the first 100 could be really key organizations that can mobilize. And the universities are extremely important because they can get to the female students, right? And we definitely want to have breakout sessions for millennials, okay, and young professionals. So you kind of already met me halfway when we talked about the 5 topics. We talked about health, we talked about mental health, and we want to put them separately.
Yes.
We want to talk about business. Okay. Definitely civic engagement.
Yes, the legal League for Voters.
That's a great partner.
We need to add them on the
Yes,
list.
that can be part of the 100. So health, mental health, business, civic engagement. Let's go with 3 more.
Oh, what topics? I'll let the other commissioners give you.
We
some
have health,
thoughts.
mental health, business, civic engagement.
What about support group? Because I know several women who are single moms
Well, that's part of resources.
That's okay.
Well,
So
because
now,
March,
if you say you want to talk about parenting, that's a subject matter.
Okay.
So where we literally have a breakout session that talks about how to better parent in the times that we're living in. I think that's great. Okay,
I
parenting.
think wealth, like finance.
We put
That's
business
on the
and
bid.
Oh,
finance.
finance already.
so since
Okay.
March is Women's
If I
Health
may,
History.
it's that this is I'm late. I'm sorry. I was and work. I was at work. So it's an event that we are planning for next year,
Yes.
March 2026.
March
2026.
Yeah.
Okay. So, everything required a budget. Do we have a budget for this event, or we gonna look for it? Because I know we have several events. I don't know if we have money left in our account.
So this is like the city of North Miami, in no way,
Is not
shape, or
taking this
form
on.
cannot pay for this.
Yes.
There's no way. They can be a sponsor. I'm
Okay.
sure they will be sponsors, but this is an annual Miami-Dade County
Okay.
Women Leadership Summit. With our last meeting, we specifically talked about what can we do as a commission here in the city of North Miami that can have an impact on the entire county based on the information that Dr. Concha gave us,
I get
so that we are not reactive, but we are becoming more proactive in dealing with these issues. And we stated that the convening of 1,000 women in Miami-Dade County would not only bring us together, unite us, and give the Commission for Women more strength and support for them to better serve their cities, but it will also give us an opportunity to gain data from 1,000 women that live here in Miami-Dade County.
Okay.
And so we decided that March would be great because it's Women's
a
History
Women's
Month,
Month,
okay? And although we know that there are a lot of activities going on in Miami-Dade County for Women's History, but there's not a county event, right? And that is being led by women commissioners.
Okay.
Okay. And I think that number one, it would really highlight the Commission for Women and women who are living in these cities. Some of them may not even know that there is a Commission for Women. And so, as Dr. Etienne stated, once we put this 12-member team together, it would be a phenomenal idea for us to do the press release and for us to really
conference, too.
a press conference, for us to really get the information out there to kind of jumpstart it even before the year ends. So women go into January knowing that Miami-Dade County is about to host its inaugural Women in Leadership Summit.
Okay, so the 12 people that's gonna be selected, they're gonna work with us to help us make that summit effect.
I recommended that Dr. Blemire be the chair of this, being that she initiated this vision for the commission, and she also met in Tallahassee with the other commissioners, and so it'll be a good way, since she already established that relationship with them, that it would be great to help facilitate the discussion, keeping in mind of the focus. When we represent the city of North Miami, but this is not about one commission. It's
about
all
all
women in Miami-Dade County.
Okay, so the 12 women, like I was saying, will be the commissioners that helping make that event possible, right?
Yes, so we're
Okay.
looking at the top, not the top, but the main Commission for Women in Miami-Dade County that we were able to interact with and that were present.
Okay, so the
Okay.
12 individual will be coming from Commission for Women in the county.
Yes.
I got it, okay.
Because the way for us to actually give support to the commission is if they are taking part in this and they're drawing the women from their cities out
I would,
to
okay,
come to this
I got it.
summit.
Yeah, that's a great idea.
Okay.
Very good.
Any other questions?
I just wanted to make a comment. So there's also the Chambers for Women or the Women's Chambers Miami-Dade.
So there is the chamber, excuse me, there is the Miami-Dade Chamber of Commerce. That is all women that can definitely be a part of this. It just so happens that I am an incoming member, a board member for the chamber in 2026. Thank you.
Congratulations.
And so I will definitely reach out to the incoming president of the Miami-Dade Chamber of Commerce for Women, who is Christine Sananjules. And so I would be sharing it with the current, the past president and the incoming president. But again, remember, we want within the next 72 hours to come up not just with the 12, but a list of 100 that we're going to begin with. And honestly, the 100 is going to come from the room of people that we had last month. Right there, we have 100 women, or a list of 100 that includes women in leadership, civic engagement, business, health, education. I mean, we had everyone present last month. So that is going to get us the 100. And then from the 100, we're going to build from that and get a total of 500.
So, Madam Chair, if I may summarize for our beloved Commissioner Flermont, this initiative, the annual Miami-Dade County Women's Leadership Summit, was proposed at the last meeting by Commissioner Blemure, Chairwoman Blemure, and it was seconded. We approved it. So since she's no longer going to be our commissioner, nor chair of this body, I felt that it would be most appropriate to have her chair the actual, to recommend her as the chair who will facilitate the planning for this event. It was recommended, it was suggested by me that she chair it and she accept. And Madam Vice Chair, Dr. Glickman, highly recommended
Balancing life.
and life to be part of this because they just had a business summit, which was fantastic. And so she felt that being that she's the executive or founder of that group and it's a nonprofit, she will be perfect to chair that on our behalf. And also identify those, the committee. Among the 12 that were recommended, we would select the main commission that within Dade County, which include Doral, Miami Beach, North Miami Beach, Miami Gardens, and Hialeah. I recommended to have one committee member from each commission. That includes us, makes 6, plus the 2 from Tallahassee, makes you a total of 8. The additional, we have 4 seats left, and I recommended to have someone from 2 people from the chambers, Miami-Dade County Chamber of Commerce and the City of North Miami Chamber of Commerce. Okay, so that leaves us in the Haitian Chamber of Commerce, whichever one.
Whichever
we
one,
would
just
get.
wanna have,
We would get some seats, right?
yes.
And then the other piece was going to be to leave the other seat for the academic institution. I recommended that we have a total of 13 so that you have a balance with 2 academic seats. It could be one from University of Miami or one from Miami-Dade College or one from FIU, whichever one is in agreement. And that way we cover that. Now, because this is a summit focusing for women, I also recommended that she reach out to some nonprofits, professional nonprofits, such as the Haitian American Nurses Association, the Miami Chapter Black Nurses Association, the National Association of Hispanic Nurses, and so on, and we can get some perspectives from them. I also recommended that the following topics need to be outlined health, mental, and when I say health, we have general health, which includes women's health, and we have mental health, we have the business,
And business
civic-
finance.
business/finance, civic engagement, and definitely fitness. Your health is your wealth, right? So if you want to add fitness, because you wanted 2 more, and since March is Women's Health History Month, everybody's focusing on our health, and so that encompasses, we could bring in I don't want this to be religion, but if we have to look at this from a holistic approach, then you need to bring some faith leaders at the table. Meaning that you can have a panel of faith leaders, whether it's their church, discussing the health of the church, the women's health, and so on. That's just another thought that we can debate on.
Okay, I love it. I'm taking all the notes, and I think that this is going to be a phenomenal initiative for the Miami-Dade County, and I think that this is going to definitely shift the county in another direction. And we're hoping that women get connected to resources, and they walk away with a booklet that has, everything you can think of, whatever their concerns, issues are, they can find someone in that booklet who can help them.
All
And
right.
I think that if we can do that in such a way that it's actually even published in the Miami-Dade County website, and we just provide tools and resources for women, we are definitely moving in the right direction as it relates to the issues concerning women in Miami-Dade County.
And we also have to keep in mind that Councilwoman Mary Estime Irvin usually do a women's event during the month of March, and so that there's no conflicting. Maybe we can combine efforts.
What
It's a thought.
she usually has it during the weekday, and it's a lunch at FIU.
Right. And just some
Do
food
we
for thought.
have a
It's good to combine efforts with whatever people are doing. sometimes.
okay, so I believe hers would be March 26th. Bertrov, can you confirm that? March 26th? Excellent. Okay.
Yeah, she usually do it.
I'll confirm.
She usually
You're
do it the
confirming.
day-
I think
she
it's
usually
March
do it the
26th.
Thursday
Yeah.
before mine.
It's 26.
Yeah.
Yeah, we have reason to believe it's March 26th. Dr. Glipman, can you just confirm that for us, please?
100%.
Okay, thank you so very much. So March 26th. And so I think if we stay with the Saturday, we'll know that we're not, it's very rare that the city has something on a Saturday. So let's stick with the Saturday. Okay.
And then one more thing. So another topic was parenting, and
Yes,
then
I have that.
maybe legal or IT. I don't know if you want to add those
Oh,
two.
technology.
Technology.
I think that women in tech is big. And so we can have business, finance, tech together and have a whole section with that. Okay, I think that we have mapped out the summit. This is great. At this time, we are going to move forward with our next old business policy proposal for Women's Health Equity and Preventative Care Initiative. Dr. Chen?
How timely.
Wow.
Yes, this is very timely. Thank you, Madam Chair. We did discuss the policy proposal for Women's Health Equity and Preventative Care Initiative, known as WEP, for particularly in zip code 33161, because that is the zip code that was mostly impacted according to research. Women in North Miami, particularly those residing in zip code 33161, face significant health disparities with high rates of uninsured residents, chronic diseases prevalent such as diabetes, hypertension, and barriers to maternal health services created a long-term risk for women's health and community well-being. And so this initiative, this proposal, is designed to address the urgent needs by expanding access to preventative care, screenings, and health navigation services while strengthening community partnership. By collaborating with mayor, council, and key nonprofit partners, this initiative will reduce duplication, leverages existing resources, and maximizing cost efficiency. The proposals seek to position North Miami as a leader in advancing women's health equity. And so we did present it to the board, and it was approved a few months ago. And I was asked to create a proposal, and I want to say thank you to my technology gurus chat. We were able to come up with a budget that we think will work. So the proposed budget, this project is a very intense project. We think that if we do a one-year pilot program, and I'm presenting this to the City of Commission for Women, number one, you need a program staff and operations, and this would require a full-time project manager, of 2 FTEs for health navigators, community health workers, part-time 3, administrative support, and subtotal staffing. This is $305,000 for this particular staffing and operation. And for program services implementation, we would have monthly health screenings, women's health hubs, mobile health unit operation, health insurance enrollment materials, clinic vouchers for uninsured women, and the subtotal for that is $280,000. And before you get panic with the numbers, just listen. Community engagement and education, we would have a public awareness campaign, an educational workshops, produce vouchers, and that subtotal is $75,000. We would also monitor and evaluate and reporting. So therefore, someone would need a data collection and reporting the software. We would need an external evaluator for an annual contract. We would have a community advisory board support, and we looked at $55,000 for that. So this project for 1 year is estimated as $715,000. $715,000 with the partnership, and this is where the reduced cost comes in. With partnerships such as MJD Wellness Community Center, who already has a mobile van, and providing those health screenings. With Hannah, Florida, who's a leader in the health industry in South Florida, with multiple nurse practitioners, RNs who would work collaboratively with MJD Wellness, the Sukomen Foundation, and of course the federally qualified health centers such as Jesse Trice, and so on. And of course, Borenquin Clinic. The city's contribution could be reduced by $150,000 to $175,000 if we collaborate with these partners. So the revised estimated city contribution would be $540,000 to $565,000. Now, when we talk about the numbers, some may say that's a large sum, but I'm here to tell you, if we truly want to invest in the health of the city and the people of the city, and when we consider partner and cost sharing, that would create the space for example, MJD Wellness Community Center could provide the space for the workshop, the screenings, the fitness program, reducing the facility costs up to $25,000 annually. Hannah, Florida also has a facility which will consider support the women's health screening and community outreach. And of course, we We have Florida Breast Cancer Foundation, the Susan Komen G Foundation, the American Cancer Society, and the Lumana Foundation. All of those foundations could consider providing mammogram and breast health resources. We also consider United Way as a source for funding and volunteer support. Again, we would have to reach out to United Way, as well as the federal health qualified health centers, which would offer low cost or no cost screening and chronic disease management. So these partnerships, as I stated before, will help defray costs, prevent duplication with mayor and council's health initiative. All the mayors and council's health initiative, we can all bundle everything together so that it can be part of this pilot so that we would not spend additional dollars. And that would expand community reach while maximizing efficiency. Some of the potential funding sources, the City of North Miami General Fund allocation from the city manager, and I know the CRA could be an opportunity. If they have seeds, they can help for funding for navigating this, for the navigator staff. We can also, I know federal grants, we have issue, but there's still some grants that we can apply, like HRSA grant, CDC chronic disease prevention, Title V maternal health, child health, and that we do have state grants such as the Florida Department of Health and Women's Health Initiative. You have the different hospitals that we can have partnerships such as Jackson Health System North, Jackson North, Baptist Health South Florida, Florida International, Barry University, and Miami-Dade College. Some of the private foundations that we can think of is the Miami-Dade Foundation, Health Foundation of South Florida, Robert Wood Johnson, and of course some local philanthropic organizations. Anyone who's watching us who believe in the health of the citizens of the city, of the beautiful city of North Miami, we want you to invest. So whether you're a developer, whether you are a chamber leader, whether you're a business owner, this is a program where you would want to say, I want to invest, I want to give back to my community, and make it your priority to include this initiative in your radar. So this is the proposed budget. I explained it. The commissioner, at this time, I open it for question. And if approved tonight, the next step would be to present it to the mayor and city council. Thank you, Madam Chair.
Thank you so very much. We appreciate the breakdown of the budget and at the request of the commission. At this time, I am going to open it up for discussion. Commissioner Fleurimont?
I'm just gonna do the calculation. Just give me a second because okay, my concern is, it's the amount. It's very high, but even we have other partners that will cover some cost by in-kind donations. So the remaining balance of this budget, how can we get that? What we gonna do to have it if the city cannot help us?
This is a proposal that the city need to evaluate, massage it, and even if it doesn't go in this year's but next year's budget, but maybe we can, propose it for a future budget because of its importance. And one of our job, this part of our job description as commissioners is to propose policy and serve as their almost liaison to give them ideas on how we can help the city. So I think if they truly want to entertain the proposal, the funding is doable. We just have to ask the CRAs, the city manager, everyone who's watching to, put this on their budget and come to a commission meeting and let's have a discussion. It just because I present the proposal does not mean that we have to implement it today or even next year. it needs to be vetted, approved, and, with recommendations. They may have recommendations to the proposal, but at least it's something that we, as a commissioner, has voted on, and we're just presenting it to them for consideration.
Commissioner Pasmino?
Well, I like the initiative, but I too have concerns in regards to budget. I do attend council meetings, and I don't think for this upcoming year they're going to approve it because I know there's other concerns in the city, but I do like the initiative of trying to do something impactful for the women of North Miami.
Right. Yeah, sustainable is the key. We want to do health fairs. Yeah, that's great, but we also want, just like Dr. Fleurmont, MJD Wellness is doing sustainable by collecting the data, making sure that the screening is done, and looking at the data to see out of all these people that are being screened, how many people are truly being referred and how many people are actually getting the treatment that they need. And so because we looked at the zip code and we saw the devastation that is going on within that zip code, we have no choice but to act on it.
Commissioner Glitman?
I absolutely agree, Pasmina idea. I want to do a baby step. I think that is a great idea. It's a big idea. Of course, Dr. Etienne is very experienced and very confident. So I don't think it's anything can have any challenge for her. But I think she can start to do the grant, and so that maybe she can come to the for the city, and just to give the suggestion, see if they have any recommendation.
Mm-hmm.
So come back to us, so that we can follow up with that. And I really think that we already have this initiative to work on for the women leadership coming up. We want to focus on one thing together and do it good. And we don't have many meetings, maybe just 3 meetings to get it work. So I want to focus on this. And her idea is great. We can work on it, and I would love to consider it. But to really go for it, we need to have a little bit more time or baby step. Thank you.
Madam Chair, if I may, giving a proposal, in my opinion, does not mean we're as the commissioner that rolls it out. That is a proposal. If it is adopted by the city, they can run with the project. What I'm saying is that oftentimes, when you write proposal, it's a policy that we're presenting, that they adopt such thing, and that, there's a process. Everything has to go through a process, and we all have full-time jobs. This is not for us to implement. This is a proposal. I just want to make sure that we understand that. Okay. Amy.
Any other questions or concerns?
My concern is not to exhaust the city.
Okay. And so before we take it to a vote, I would like to hear what are the suggestions. And so we just don't say no, but how would we like to take a bite at it?
Personally, everybody knows that healthcare, it's the only thing in life that I like. It's beautiful, like Pasmino says, but to be realistic, all needs to be done, because right now we have a crisis, especially in the STDs. We have a lot of people in Miami-Dade County that get infected every single day. The chronic disease is a it's there. No one taking care of them. Sometimes they don't have insurance, and the way that the insurance is, if you're not working, you cannot have it. And Medicaid, you cannot even count on it. So, to not rely on the city to approve or to execute our plan, which is a beautiful plan, I think that it would be nice that we take the baby steps. We took one at a time. Let's say if we're gonna focus on doing screening, MJD and Anna will do screening in every park once a month. That we don't have to ask for money. We don't have to ask for nothing. It's part of our mission to provide a free health screening once a week on one park. And we have 4 districts, right? And each district, we provide a health screening once a week or once every quarter. So that way, we are not depend of financial from the city or from the commission, which is we don't have to have that. And then maybe after 3 years, the city may have money. They said, okay, we're gonna do that. We're gonna look for partners to do it. But financially, I think to have it next year or by the 2026, let's start by the screening. We can have like Borinquen and other organization that in Miami-Dade College, those students are very good. So they can come for free and provide those services for free once every quarter or once every month. To help us. But I think coming with this amount to the city council, to the member of council, I don't think they're gonna say no, but they're gonna really think about it, especially with the situation that we are living in the city of North Miami now. That's my point.
And I also want to add, like, when I joined the commission, I wanted to help women in North Miami. I think amongst the 5 of us, like, now I know that if I come across a female that is need of medical attention or has any concerns, I can refer her to MJD Wellness or, reach out to Dr. H. So I think that we as individuals need to let the community know, hey, woman, if you need resources, approach us. We will help you get to the place you need.
Mm-hmm.
So I think if we do show the commission that we are actually doing stuff, then maybe they'll be like, okay, they're making an impact on their own. Let's, support them. Let's give them, if we give them money, let's see what else they can do. So if they see that we ourselves are doing stuff, it'll probably provoke them more or initiate them more. Because I do get people asking me, what do you guys do? So I do try to say, hey, we have all these ideas and we do try to help women and we connect. And so that's where I'm coming from. And not only that, I know the community, they're going to be sitting here and they're going to, during citizen forums, they're going to say, hey, this is going on in the city. The seniors are losing, North Miami Senior Foundation is almost going to be gone. So there's all this other stuff that they're going to say, there's other places you guys can devote the money to or prioritize.
Any other concerns? Is it the consensus of the board to move forward with, well, before I say that, I want to preface, I want to say to the Commission for Women that, we cannot be afraid of not just asking, but casting a big vision. Because at the end of the day, until you launch into something deeper, you really do not know the impact that you can have, right? As long as we stay here very comfortable behind this dais, and it's the 5 of us, the 6 of us, the 7 of us having meetings and discussing possible proposes and what we could possibly do, we're never really going to manifest that impact. That's just the truth of it. There's no way for me to say that. If you think limited, if you think, okay, this is all that I can do right now, this is as far as I can go, then that's what it's going to be. But the minute you launch out and you start to think bigger, and you start to think about impact, and you start to think about, 30,000 plus women, because that's who you're called to serve here. Okay, the city of North Miami has about 60,000 residents, about 51% is female. It's 30,000 plus women. The minute you start to think about 30,000 plus women, you have to think about 500,000, 1 million, maybe even 2 million with any project, if you really want to actually make that impact. Now, I do understand the concern, where are we going to get the money? How can we get the money? But I would caution you to not say no because you don't know how. I would caution you to begin to ask yourself where. Because the money's there. You just have to find it. There is money out there specifically for these type of initiatives for women. That means that you got to do the work. Somebody's going to have to roll up their sleeves, pull out their computer, and start applying for grants, start applying for seed money, start applying for opportunities that maybe come from the county, start having conversations with Miami-Dade County Mayor. I mean, it requires you to work. I'm not saying 500,000 is just going to walk in through the door, but what I am saying is if you look for it, you're going to find it. The real question is, are you willing to do the work? Are you ready to do the work?
Well, I'm just going based that I have not. We were going to do a mentorship thing. We have not done that. We were going to do a fitness
And
thing.
why? Why have we not done that? It's not because
Financial.
we can't. No, it's not financial.
Okay.
It's not financial. Commissioner Pazmino, yes, there is a financial component to it, but it's not the financial component that stops us. It's us not having the willingness to go out and find it.
Okay.
You cannot tell me that in this city, if we decided that we were going to take half a day and knock on small businesses and say, we are here from the Commission for Women, we represent 60,000 women, we are looking to do X, Y, and Z, we need for you to donate to us. We can raise $25,000 in one day. We're not willing to do the work.
Okay. I don't want us to forget, because I don't forget that easily. One of the things that we discussed, we put certain project on hold so we can focus on the event that we just finished, which was the women's brunch, right? So we finished with that. We all agreed that we would put everything on hold so we can focus on that activity. Now that we're done, we're back to this. So we're back to the proposal. So we're discussing the proposal right now. And I, out of respect for Commissioner Mueller, who's in charge of certain project, who's not with us this evening, we wait for her to give us directive.
And just for on the record, the mentorship program does not require money. We have not specifically stated or discussed any monies that would go through it, that would be allocated to it. Again, I think that the clear, I'm not saying to vote for this, I'm not saying not to vote for it. All I'm saying is we have to get to a point where we come out of our comfort zone and do what is necessary to deliver. Again, I mentioned the 50 female startup, $25,000. I mean, literally, the brunch. How much money did we raise, Narissa? Mm-hmm. As she find the report.
We have raised from the group
1450 for the booth and 5600. So total of $8,050 that we raised.
How long did it take us to do that, Narissa?
A couple weeks.
Literally 3 weeks.
So we're not in the red. We're fine.
No. And actually, I made a specific request to Assistant City Manager Katia Filippo to give us a rundown of every item, because I do not want to leave with this board with not one bill unpaid. So what I'm saying to you is that it's not that we don't have resources. It's not that we can. We have not applied ourselves to get it. Narissa and I, in less than 3 weeks, raised $8,000 for the brunch.
Okay.
Now, what is it easy? No. I am not by any means saying that it was easy. I'm saying if you put the time and the effort, you knock on the door, you're going to get something. It may not be all that you're looking for, but you're going to get something.
Okay.
And I did not stop knocking until we raised every dollar. And at the end, how much in the plus we are?
Mhm.
We
And
have
just the
$327 left.
Mhm.
So,
Yeah, it was. Mhm.
so we're going to vote on this because we have another pressing item on the agenda. We're going to vote on it. All I'm saying is we have to get to the point where we're ready to do the work. And doing the work means raising money. $5,500 that Councilwoman Mary Estime Irvin allocates to us is peanuts. Peanuts. It's a supplement. She's giving you something to start with. It's like, you know, you have a huge project and someone says, hey, you know, here's 10% of it. But you can't say, okay, well, I can't do anything else because you only gave me 10%. No, that's not how it works. You take what they gave you, you multiply it, and you do something bigger. So listen, I'm not going to beat a dead horse. Let's take it for a vote. Commissioner Dr. Maria Tien, can you please make the motion?
I make the motion that the proposal be accepted by the Commission for Women and subsequently be presented to the council, mayor and council.
Do I hear a second?
Second.
Okay, Commissioner Glitman, how do you vote?
May I make amend the motion?
How would you like to amend the motion?
I would like to accept the proposal, but with the suggestion from Dr. Vermont and Claudia Pasmina to start with no expenses to start, so we can show the city that we show some effort to earn some of the support so that we can really express ourselves and earn their support in the future.
There's an amendment on the floor. Commissioner Tien, your response to the amendment.
Yeah, I do not accept the amendment only because this is simply a proposal that we have to present to the city to see if they will accept it. We can't do anything unless they say yes or no. We, as a commission, agree on a policy, and now we're presenting we have to present the policy to the mayor and council along with a budget. Now they can give recommendations and strike X, they can do whatever they need to give recommendations, but my job is done by furnishing the policy and have the budget to go with it that we present to the mayor and council for consideration.
Okay, so then we're back to the original motion.
My vote is no.
Vote is no.
Mhm.
Commissioner Vice Chair, how do you vote?
Sustain? No?
You can't sustain. You have to
No.
either vote yes or no.
Okay, so we have Dr. Etienne, how do you vote?
I vote yes.
Okay, Dr. Florimont?
Yeah, it's nothing hurt. Propose it to the city. I vote yes, propose it and see what they say. But one thing I want to add, what Glickman said, it's correct. Let's start. We can prove them the data. How many people that we saw, how many people who has chronic disease, who doesn't have health insurance now. We have the fact. We need that. Now you don't have nothing that gonna come. The only thing, they're not gonna read that. They're just gonna read the numbers. Oh, they are playing. But when you bring it with the fact, you have a list of 40 or 50 women who doesn't have health care insurance, that has chronic disease or has any type of disease. Now they're going to understand the value of the money that we request. No,
The data was presented to us last month meeting. That was very
data
clear.
was provided, Dr. Etienne, from Miami-Dade County, not for the city of North Miami, because they are not in Miami-Dade. They are the city. They're concerned about what's going on inside of their house, not someone else. But that's my point of view. But I agree. You know, that's my food, my water, and everything, healthcare. But we gonna bring it to someone to help us. But we need to give something that's strong. They cannot say no. But right now, they're gonna say no. Let's start working, Dr. Etienne, by January. Maybe in May, we present it to them because they don't know what's going on out there. You and I, yes, we know. Let's present it to them with some data, with some real client, with their measurement. We're just gonna above the name, leave the address, and then the blood pressure, the blood sugar, and everything, the disease, and then we said, this is what we have. We need this to help the city. They're not gonna say no. That's my point. I agree with. I vote for this, but I want to wait before we present it to the city.
So, Dr. Emanuela, your vote seems a bit, in the middle. So, as is, Dr. Etienne, Commissioner Etienne would like to present it to the board as is. Commissioner Glickman says no. Commissioner Pazmino says no. What do you say?
Presented like that with no fact, I wait. I said, no, not now. We're not ready. We're not going to go there and then lose. No,
Okay.
not yet, not now.
Okay. We needed 3 votes. Motion fails. What do we want to do now?
We drop it.
No, Dr. Etienne, we're not dropping it.
No,
We're
I'm
going to
saying
work for 3 months.
We
Okay, what
dropped
do
the
you
proposal.
propose?
I propose working for 3 months between MJD and other school, Miami-Dade College. We have that. We have the resource. So we go in the community in Miami-Dade. We're gonna ask for the commissioner to give us 1 day in their district. So we go, we pull up the data, we bring it to them, and then in May you present that so they can know what is going on, and then the next budget they add us. That's my
So
suggestion.
Commissioner Florimont is proposing that the work that is outlined here be done on a pilot basis for 3 months. The data taken from the pilot be presented as an addendum to this proposal and budget and presented to the city on or around about the month of May. That is the motion on the floor. Commissioner Pazmino, how do you vote?
Before we vote, I'd like to make a comment.
Yes.
I'm not sure if we need to redo this survey, but we did a survey in the city, and I have the data in front of me of the specifically for city of North Miami. That was presented by Commissioner Magda. The city of North Miami, approximately 49.8% of North Miami residents are women. There is a 10% wage gap, 35% women in homes versus 64.2 rent. They 15.5% are without health insurance coverage. 19.9 women report depression. 10.9% have a disability. You have breast, lung, and colorectal cancer account for 50% of new cases. 345 women give birth without prenatal care, and infant mortality continue to be the highest risk for mothers. And 72.3% are considered physically inactive. 34.2 of women consume 2 or more servings of vegetable per day. Leading causes of death, heart disease, cancer, and stroke. Again, in the city, 2,889 human trafficking cases involving women and children. 21% of firm businesses are women, and the pay gap remains. So the data, statistic data, is from the Official Commission, and we have reports that comes out every certain years. This data was stemmed from 2021, but when you look at data, when you do statistics, the data doesn't change overnight. And so we can take your suggestion, and being that you have the mobile health, and you can start collecting the data, but this specific proposal was for zip code 33161. So unless you go into focus on that particular zip code, then you're doing something for the entire city. So I just wanted to bring that up. Thank you.
So at this time, thank you, Commissioner Dr. Etienne, for reminding us and reading into the record the stats from
The data.
the data that was taken by Dr. Demerit.
Mm-hmm.
And so at this time, we have a motion on the floor by Commissioner Fleurimont to work on a pilot for 3 months.
Mm-hmm.
And this motion is being presented due to the last motion failing with insufficient amount of votes. At this time, Dr. Fleurimont, how do you vote?
How do I vote regarding for what I said?
Yes.
Yes, I wait for, yes, I
So 3 months,
yes, 3 months.
okay? Pasmino?
Yes.
Yes.
Glickman? Dr. Etienne?
I like the recommendation, so my vote is yes. Mm-hmm.
Okay, the item passes unanimously. Dr. Fleurimont, we have our final meeting next month, December 16th. Can you please come forward to present what you will do in the next 90 days and the assistance that you need from the board
What do I need regarding the,
to do the pilot, the 3-month pilot program?
okay, I will, Dr. Etienne, I would love you to be with me because since you've been working with that project,
Mm-hmm.
so what I'm gonna do is contacted the board and let them know that the city will need the mobile to do some project, and then I will come back with the answer, and Dr. Etienne will contact Anna and to see if we will do the partnership to provide the service, and the city has to give us allocation where we can
For the zip
send-
code.
Yes, but the zip code that Dr. Etienne provide. So
And it's very important that Dr. Etienne mentioned that this is zip code specific. And so I think that a major part of this is identifying how you're going to target 33161. Okay.
33161.
Yes, that is the zip code. Okay, wonderful. Do we have, moving on, do we have any questions, concerns? Okay, at this time, we're moving down to our discussion. As I shared with you, couple of weeks, I would say about a month or so, I will be resigning as the chair for the North Miami Commission for Women, effective December 31st, 2025. It has truly been my honor to serve as chairwoman of the North Miami Commission for Women since March of 2021, 4 years and 9 months. Okay, December would make 4 years and 10 months. Over these past years, we have worked together to uplift women, strengthen our community, and advance a shared vision of equity, dignity, and empowerment. As I step down from my role before the end of my term, it is with complete confidence and great respect that I pass the gavel to our vice chair, Dr. Narissa Glickman. Narissa has been a steadfast partner and contributor to this commission, a great leader and someone deeply committed to the mission and the values of the North Miami Commission. Tonight, I am pleased to formally appoint her as the new chairwoman for the North Miami Commission for Women, effective December 31st, 2025 through December 31st, 2026, which would have been my term. I know she will continue to lead with integrity, compassion, and a clear vision for strengthening the lives of women and families in our community. I ask that the board join me in congratulating and welcoming Chairwoman-elect Narissa Glickman.
Before you do that, I want to make sure we follow proper procedure. Since you are stepping down, our bylaws, I want us to review our bylaws.
It specifically says that we appoint a chairwoman
Right.
and
I
a
wanna make
vice
sure-
chair.
I want to make sure that she is going to be appointed for the remainder of your term.
My term would have ended December 2026 because I believe you served 2 years,
Right.
right? And so I had chosen not to do a full 2 years,
Right.
but I would have served until December 2026.
Right. That's what I want to make sure the record is clear
Yes.
that we don't need to take a vote because she is stepping into your shoe.
Correct.
Thank you.
Correct. Thank you. Thank you so very much for stating that. So we know that each person is in position for the term of their elected council person or mayor, if the mayor is the one who appointed you. I was appointed by Councilwoman Mary Estime Irvin, who appointed me in March of 2021.
When does your term end?
That my term would have been complete. So in essence, as long as the elected member of the city council is in position and she chooses to continue to have me to serve, I continue to serve at the will of the council person. And so technically speaking, at the end of her term, which is December 2026, because there's elections in November, if there's a runoff, we know that in January, that's when the change happened. Given that Councilwoman Mary Estime Irvin would be reelected, I would continue. But that doesn't mean that I continue as chair. I would have continued as chair until December of 2026. And so because I would have continued as chair of December 2026, we are not electing a new chair. We are appointing a new chair to complete my term.
Actually, just for clarity, you were elected by this board from April to April. So your term would finish April 2026. So this April, your term ends. And then we'll have election for someone to take on and be sworn in at the election, actually in March. And then the election would have taken, just like we did, 2 years go so fast, believe it or not. Because when I was chair, from 2022 to 2024, and then you took over from 2024, then you would have been finished in March 2026. And officially, the new chair would have stepped in April. So just for the record, at this time, Dr. Glickman is finishing your term as chair because she's your vice chair. She's stepping into the role as chair until the next election. We can decide as a board to renominate, revote, but tonight we're not taking a vote because Dr. Glickman is assuming the role of the chair.
Okay, so I didn't think that this was going to be a challenge.
It's not a challenge. We're just making clear.
No, I didn't know that this was going to be a challenge. I think that it is fair to say that, as I shared, when you were elected, it was supposed to be annual. It didn't go annual. It went for 2 years. And so that is the only reason why I was elected in April, because you served for 2 years, and that would have not been, that should not have been the case. Nevertheless, as the outgoing chair, in order to create some kind of consistency within the board to ensure that the board has a vision, having someone go from January essentially, right? Because December 31st, you're saying from January to April, does not lend to that. Okay, and so that's definitely as a leader, I don't want to do that to this board, right? I don't want to halfway into the year for the person who succeeded me because I resigned have to go through an election process again. And so we're going to take a vote. So I am proposing that Dr. Narissa Glickman not only takes over as the chair to complete my term, but Dr. Narissa Glickman will remain as chair for the North Miami Commission for Women from December 31st, 2025 to December 31st, 2026. At this time, I'm bringing it to a vote.
Before we take a vote, I think out of respect for the two other commissioners who are not here tonight, they left here with the assumption that the term would end in March 2026 because that would have been 2 years for you serving. And then we would have election. So we have not officially given an opportunity to the other two commissioners to have a voice. I think out of respect and proper procedure that I have no problem for Dr. Glickman to chair, but I like to follow things by the rule.
Okay.
That at this time, because she is our vice chair, to continue as chair until we have election.
Thank you so very much. Thank you so very much for your recommendation. We respect your recommendation, but I also respect the fact that there should be continuity. And in order to have continuity, you must have a leader. You must have a leader at the helm for a period of time so that the commission can work effectively. And so as the current chair, it is clear that once there is quorum, all decisions, all business can be presented. So as long as there is quorum, it is voted on and it is applied. If someone is not here, that is unfortunate. But the reason that it is stated for us to have quorum is so that business can continue no matter who is here. And so at this time, I am bringing it to a vote. Dr. Florimore, how do you vote?
I vote no because she has to finish your term, and then while she has to do election to start the way that we started from the beginning.
Thank you. Pasmino, how do you vote?
I vote yes. Am I add something? No. Okay.
I vote yes. Narissa Glickman, how do you vote?
Yes, sure.
Dr. Etienne, how do you vote?
What was the motion? Are we voting to,
The motion on the
term?
floor is that Narissa Glickman will assume the chairwoman's seat for the North Miami Commission beginning December 31st, 2025, and she will remain in the seat until December 31st, 2026. How do you vote?
my answer is no,
The motion passes 3-2. Thank you.
because I feel like to follow the rules.
Next.
Madam Chair, it's like we start away. Let's finish the same way that we started. We never had a chairperson that finished their term for 2 years, that April, May, June, July, August, September, October, December, for 2 years and 8 months. So let's follow the same
Who
rules.
served for
If-
2 years and 8 months?
No one. So
Okay.
if you decide to let Dr. Glickman to finish on December 2026, so
That is,
she will be
serve for 1 year.
no, she has to serve your term,
My-
which is end in March 2026. She's still a board member, but now she has to do election in March. Maybe she may be reelected,
Doctor-
but not let her continue the
Doctor-
2 years, but she's gonna make 2 years and 8 months. That's what Dr. Etienne tried to make, that, the clarification of our regulation, our process of being elected a chair for the board.
Dr.
So
Dr.
I
Florimel,
will, yes, I will prefer that we wait for the 2 other members.
the vote
So
has
we
already
are-
been taken, Florima.
So if it's that, we are not in this dictatorship. We are working together. We have to do what is clear and what is in the
Dr.
book.
Florima,
That's my
there is
point.
five members of the commission who have been duly appointed by their council person. Tonight, there was a motion on the floor for Dr. Narissa Glickman to take on the helm of the Commission for Women beginning December 31st, 2025, and to end for 1 year, December 31st, 2026. 3 members of the commission voted yes. This is not a dictatorship. Three
process
members,
is not-
3 members voted yes. That is the process. Dr. Glickman has served with character,
We're
with
not
integrity.
judging Dr. Glickman character.
Hold on.
We're
Hold
not
on.
saying she's not.
Don't make this
Hold
about her
on.
character,
Hold
please.
on. She has served with character, with integrity, and she has shown her capacity to serve. I have stated as the outgoing chair, in order for there to be continuity, we do not need to be having another election mid-year, which is not even mid-year. You're talking about 4 months. That is not leadership. There is absolutely no reason why Dr. Glickman cannot serve for a full 12 months.
Madam
There is
Chair.
absolutely no reason, unless you can tell me of a reason, why she would have to serve for 4 months and then have an election.
I have a reason. The reason is we have a bylaws. We agree among ourselves that we would serve 2 years. I served the first 2 years because I was the first.
We never agreed to serve 2 years, Dr. Etienne.
We sat on this.
You happen to have been in the seat and continued for 2 years, but no one ever voted for us to have one chair for 2 years. That never happened.
We did not vote you for 1 year. We voted you for 2 years, 2024 to 2026.
If
So if you were voted for only for 1 year, you would have
hold
been
on
done
one
already.
second. If
Okay. Thank you.
if you voted, you did 2 years. If you voted me in for 2 years, what does that have to do with me resigning from my 2 year? And as the chair, presenting who is rightfully, duly.
We're not checking.
Hold on, hold on.
We're not debating
Come on,
Dr. Glickman.
Dr. Titz, what are we
Do-
debating then?
We're debating the process and doing things fairly and equitably.
Three members of the board voted.
The process is that you do not have the authority to appoint a chair.
I'm not appointing.
No.
a chair. I
That-
said she. will
Those were your
continue.
words. Those were your words at the beginning.
I said she will continue my time, and in order for there to be continuity, she should
I
remain
get
for
that.
a 1 year.
I still get it. Just like any general election, if someone stepped down, they finish out the term of that person, and then we do election. Even if we say, Dr. Glickman, we revote you again, but at least there was a process that was
And
followed.
when you presented that, I brought it to a vote. 3 members said yes.
I'm just backing up what Dr. Emanuela
What you're
stated.
backing up makes no sense because you said to me, it's not right for her to stay beyond my term. I said, okay, bring it to a vote. 3 members said yes.
Okay. All right.
Thank you.
Good.
Thank you. May I say, at this time, I would like to thank our chairwoman with all her effort to put everything together. I don't know how can I, we don't deserve her. So I want to present a little something to thank her before the holiday, to thank her for everything she did for us. And let's stand together and give her this appreciation.
Oh, nice.
This is presented to you from Councilwoman Mary Estime Irvin. Whereas the city of North Miami is pleased to issue this proclamation in honor of Naomi Esther Bermuda Day today. Whereas Naomi Esther Bermuda is an established leader, author, advocate, and entrepreneur whose life work has been dedicated to empower individual and family to discover purpose, cultivate balance, and embrace their divine calling. And I'm going to share with the board so that we can be a team together.
We're always a team. Just don't have to agree to it.
It's okay.
And the number 2?
Yes.
The whereas Dr. Blemure is the co-founder of Balancing Life and the chairwoman of Pearl's Wisdom. Naomi has played a pivotal role in building thriving, resilient communities through education, mentorship, empowerment, impacting the emotional, financial, spiritual, and educational growth of countless of residents throughout Miami-Dade and beyond.
Want to share? May I?
Where did she drop off?
The third one. Yes.
Whereas Naomi Global Academic Journey, including studies in Italy, France, and Spain, as well as degrees in accounting and public administration, reflects for her commitment to excellence, lifelong learning, and international understanding, which she has brought home to enrich the culture and educational fabric of North Miami.
With the last one?
Yes, okay.
Ay, my eyes. Okay, now, therefore, I, Dr. Alex Dejolme, Mayor of the City of North Miami, along with the Mayor Cassandra Timote, the Vice Mayor Cassandra Timote, MPE, Councilman Kervin A. Byrne, Councilwoman Marie Irvin, Estime Irvin, and Councilman Pierre Charles, be here proclaim November 18, 2025, a Naomi Esther Blemure Day at the City of North Miami.
Thank you, Madam Vice Chair, for making sure that my request was followed to get that proclamation for our chairwoman, because we believe that she has served the city with her strength, dignity. She has served us wonderfully as a chair, and although we did not continue implementing all of her vision, but the work continues as a commission. As long I sit on this board, I will remain fair and do things by the book. Thank you.
Thank you so very much, Commissioner Glipman, and the entire board. Thank you so very much to Councilwoman Mary Estime Irving for entrusting me with this responsibility. I didn't take it lightly, and until the last day, I will serve with heart, with courage, and with conviction. Thank you.
Thank you. May I make a motion to adjourn the meeting?
I want to say thank
Oh.
you to you, Madam Chair, and you will be missed. Please don't leave us, so always be there and help us and guide us. We need women. We need more women that can help the city of North Miami become better, especially in your field. And we need help for our women in business in the city. Thank you for your service.
Yes, I want to thank you again for your service, for your leadership. I am learning a lot from you, believe it or not. And I know this is not the end. You're going to continue with us, with the city of North Miami. So I don't see it as a goodbye.
Thank you. Thank you so very much. It has been the honor of a lifetime to serve in this position. And I am grateful and eternally humbled by this experience. At this time, public hearing is now open. Seeing none, public hearing is closed. The time now is 8:59. Do I have a motion to adjourn?
I make a motion to adjourn.
Second? We are dismissed.